Hello, this is going to be a review lecture for Chapter 5, which is the physiology of phonation. A quick review of basic acoustics. Acoustics is the study of sound, airwaves in the air, energy in the air. Sound is an audible disturbance of that. If you have no disturbance in an air column, you have no sound. All right, a vibrating body causes us to perceive waves in the air, and that's perceived as sound. The period is a calculation from the beginning of a wave all the way to the end of it, right? It's a period of time that we're measuring. The amplitude is the maximum amount of displacement from resting position to the crest of the wave. But we're not gonna use amplitude as much. We're gonna talk more about intensity. All right, the intensity is the magnitude or strength of a combination of rate and density of energy transfer. In other words, we psychologically perceive what we call loudness. Now, loudness is somewhat of a touchy term because what is loud to me may not be loud to you. But in speech and hearing, we often talk about the intensity of a sound, and that is the loudness of it. We also talk about the pitch of a sound, like pitch, like on a musical scale, the notes going up and going down. Frequency is a measure of pitch. It's how often a wave repeats itself. So a very slow repetition of a wave is going to be a low pitch. A very fast, rapid repetition of the wave is going to be a high frequency. Speech sound production is determined largely by the mass of the vocal cords as well as the tension of the vocal cords. So we'll find out more specifically what that means. But mass is not the same as weight, but you can sort of conceptualize it. Vocal cords that have a lot of weight or a lot of mass, sort of crunched in, shortened and fatter, they're going to decrease the frequency, they're going to decrease the pitch of the vocal cord production. When the vocal cords are tensed, when they are stretched and tighter, that's going to increase the amount of pitch or frequency. Elasticity is the ability of something to sort of, when it's been stretched, to get back to its original shape again. Okay. Sometimes when we talk about elasticity, we talk about how stiff the structure is also. Inertia is the desire, if you will, of an object or person once it's at rest to try to stay that way, or conversely, when it is moving to try to keep in motion until it stops. All right. This energy is caused by the changes in the air pressure. Remember, we've said this a number of times, your vocal cords do not vibrate actively. They vibrate passively. Because of the airflow going through them, it causes them to vibrate. Now, when you go into a big room, a cathedral, a temple, an auditorium, a music hall, a lot of times there's a certain type of resonance in that. Sometimes I know I've been in halls or churches where even like people whispering in the back can be heard up front because that hall has really, really good resonance. Every chamber has a resonance factor, or characteristic resonance for. The resonance qualities of your oral and laryngeal structures determine what your voice sounds like. Right? Over time, my voice used to be a little lower, but my structures have changed a little bit. So the resonance in my oral structure, my larynx has changed. My voice is a little different now than it was when I was younger. When your nasal passages and your nose, for example, is clear and open, when you don't have a cold, that's one type of resonance. When you do have a cold and your nose gets all stuffed up, the resonance changes. And that's when we sort of say, I've got a cold in my nose, I can't hear anything. It's because things have been clogged up there. Right? The resonance characteristics of my oral structure have changed. Vibrating frequency. This is a real key term. We talk about resonating frequency. Any vibrating body has a natural frequency or a natural resonance. We talked about that a little bit. Sound, there's 4 basic types of sound. There's simple periodic, where it's just we think of that as a pure tone, a single note on a musical scale, for example, very pure. And then we talk about complex periodic, where the sound is characterized by more than one frequency put together. So you can have like a chord on a guitar or a chord on a piano, or even something we call diplophonia, which is when your vocal cords are vibrating in such a way that you actually produce 2 different sounds at the same time, 2 different pitch levels. All right, so there's simple and complex, and there's also aperiodic, which means the frequency pattern is all sort of messed up. We can think of that as sort of white noise, a hissing white noise. And then we have mixed or aperiodic, where it can be both periodic and aperiodic elements. So there can be a combination of a sound, like a musical note in there, as well as a lot of white noise. So we measure fundamental frequency. We often want to find out certain questions, like what's the lowest frequency that is being produced by a person? Has their voice changed over time or according to their sex? What's the maximum amount of time that somebody can phonate? What's their optimal fundamental frequency? What is their habitual fundamental frequency? We'll explain this in a second, but they are not the same. And what is the range of their phonation? Those are key things that a speech pathologist or an ENT may want to look at in a patient. The rate of vibration in the vocal cords. You have something called the optimal or fundamental frequency. That is the average fundamental frequency at which vocal cords vibrate most efficiently for a person's oral structure, okay, and phonatory structure. We call that the resonance frequency. For males, the average resonant frequency is about 120 hertz. For females, it's a little higher. It's about 220 hertz, a little bit higher pitch on average. Now, a second factor to consider is something called habitual pitch. So the first one is your optimal pitch, the most efficient voice production level in terms of frequency. And then we talk about someone's habitual speech. What that means is that it's the frequency that you use sort of by habit every single day. Now, that may not be the same as your optimal one, all right? And if you continue to use a habitual speech pattern, voice pattern, that is quite different than your optimal one, that might lean towards the neighborhood of vocal abuse. So why would somebody want to use a habitual pitch pattern, which is a little bit different than their optimal one? Well, it could be that when you're speaking louder, when we get up to speak in front of a crowd, we tend to raise our voice in terms of pitch a little bit higher. When you're trying to act more mature or forceful, sometimes you go lower. You try to sound very deep in your voice when you're trying to make a point sometimes. And sometimes when there is the quality of the voice, when a person is transitioning to another sexual identity, there's a lot of reasons why people can want to change how their voice sounds, even if it's not their optimal, most efficient vocal pattern. We look at the pitch range of an individual, how low they can go easily, comfortably, and how high they can go easily, comfortably, in terms of a pitch range. Now, this can be reduced by pathology, which means someone has an illness or an injury. The pitch range can be changed. And it can also be increased, for some people anyway, many people, you can be trained to change the pitch range. All right, most people will be able to be taught to go a little bit higher, go a little bit lower with some proper training if you need it, unless there's some pathology that stands in the way. Normally, everybody's normal pitch range is about 2 octaves. The male range is a little lower, female range a little higher in terms of our pitch ranges. The mechanism that changes our pitch, the cricothyroid and thyrovocalis muscles are key to this. But what I want you to know mostly is that changing the pitch depends on the vocal fold movement of tension, how tense your folds are, the length of the vocal cords, if they're elongated or whether they're scrunched up, and the mass, how sort of thick they are, okay? Increasing vocal fold length increases the tension and decreases the mass, all right? So if you want to raise your pitch, you increase the length, you increase the tension, and decrease the mass, and you will produce a higher pitched sound. Now, there are different types of what we call modal or customary vocal fold vibration. The first one is called modal phonation, the phonatory pattern which is used in normal phonation, most commonly by normal adults. We call that the modal pattern. It can happen in two ways, all right? The way that the vocal cord vibrates, the way the vocal cord moves. It first can be looked at in terms of its transverse dimension. The vocal fold usually starts the vibration in the front, and then goes to the back, and then opens again, and then front to back, front to back, front to back, okay? They close then back to front. We also look at the vertical dimension. The vocal cords are here, and there's an air column being forced through them from below in your lungs. And when you do that, you begin to sort of blow the cords apart. And so the vertical dimension, the vocal cords open from the bottom, and then they eventually open at the top. And they close from the top to the bottom. They start at the bottom, go to the top, and then top back to bottom again. There can be some variation there, but in individuals, but usually that's the pattern. It's front to back and bottom to top. So some different types of voice patterns. The first one is falsetto, which is a very high pitch range. The vocal folds become thin and elongated. The margins or the edges of the vocal cords are very tense. Excuse me. Glottal fry is something we need to talk about. Glottal fry is a very, very low-pitched vocal pattern. When a person talks at a lower pitch, sort of a raspy voice, and it often happens at the very end of a sentence where you sort of tail off, okay? So I'm going to say a sentence normally, and I'm going to say a sentence where there's a lot of glottal fry. So the first sentence, I went to the zoo with my grandchildren yesterday. Or I can say it, I went to the zoo with my grandchildren yesterday. All right, that's an exaggeration. But a lot of times, people, especially young people today, they engage in what's called glottal fry, and they talk at the lower end of their voice sometimes. And a lot of times the sentence starts high and ends low. All right, next. Vibrato is, most commonly we hear vibrato when we're talking about a singer. Rapid small changes in pitch, and it's often vibrato is used to give some color to the song, color to the music. All right, some singers use a very pure tone, no vibrato at all, and there's other singers that use quite a bit of vibrato. Whispering is not really technically an example of a type of phonation. It's sort of a non-phonation, non-phonatory sound production. But it's there is no vibration of the vocal folds. It's just the air is going through, and it's sort of the vocal folds are approximated a little bit, so there's enough turbulence in that air tube so that you hear a whispering sort of thing. But technically, whispering is not a vocal modality. There are some theories in your notes of different types of vocal fold vibration in terms of what really causes it. All right, the theories behind it. There are 3 of them listed in your notes. I'm not really that concerned that you memorize those 3. The thing that I do want you to understand and internalize is that we don't fully understand how our vocal cords vibrate. We have theories, we come pretty close, but we're not quite there yet. The 2 most important factors that you should know now is that vocal cords vibrate from the front to the back, and they vibrate from the underside, the bottom, to the top. Right? So make sure you know that. We make various changes in our speech by using pitch change, intensity change, and sometimes we use both of those as we're talking. All right, so how do we change pitch? Pitch is going to go up or down depending on certain factors. As the tension in your vocal cords increases, the pitch goes up. As the muscles tense, that will result in higher pitch. And if your muscles are lengthened, the vocal cord muscles are lengthened, that raises pitch also. Now, conversely, if you increase the mass, in other words, make the vocal cord sort of heavier, if you will, the pitch is going to decrease. If the muscles are more relaxed, the pitch is going to go down. And if the muscle is shortened, that will also result in a lower pitch. So basically, what do the folds look like with very, very high pitch? The folds are longer, thinner, stiffer, and more rigid. All right, for high pitch, they're longer, stiffer, thinner, and more rigid. If you want a lower pitch, you increase the mass, make them shorter and thicker. What about respiratory changes during pitch change? Okay, if you want to increase the fundamental frequency, the pitch, you increase tension and medial compression, right? The tension in the cords and the medial compression, which means how hard they sort of come together in the middle. Increasing the tension increasing the tension requires increased subglottal pressure. You need more power, air power underneath. And the subglottal pressure increase does not necessarily increase pitch itself, but what it does is it helps you maintain a higher pitch. It's like the support of talking or singing at a higher pitch, that subglottal pressure. Remember that subglottal pressure is very important for phonation. If you don't have subglottal pressure, you really can't phonate at all. Now, the phase vibrations, okay? The sort of three phases of vibration, if you remember, there's an opening phase, all right, there's a closing phase, and then there's also a phase where it's completely closed off together. So in regular conversational intensity, the opening phase takes up about 50% of the time. So in regular conversation, loudness, the opening phase takes up about 50% of the time. The closing phase, where the vocal cords are coming together again, is about 37%. And then sitting and resting for a split second is about 13%. But as you speak louder, the opening phase drops to about 33%. The closing phase is about 33%. And the rest phase is about 33%. So the effect of speaking louder means those three phases sort of equal out in terms of time. There can be a lot of variation among individuals. There even can be a lot of variation among people, one person speaking at different times. But generally, you do not want to change vocal intensity, or you can't really change vocal intensity mid-vibration, right? As the vocal cords are vibrating, that three-stage sequence there. You really can't change the intensity during that one cycle, right? You have to finish the cycle of vibration and then add more power so that you can change the cycle. All right, this is important. Yelling at too low a pitch. So you see people at soccer games or whatever. And if you want to yell, I've already said today, that if you want to yell, it's better to use a higher pitch. But a lot of times people try to use a lower pitch when they are yelling, and that can result in vocal abuse. You're working the cords too hard. All right, so we want to look at the range of phonation. All right, it's usually about 2 octaves. You want to look at maximum phonation time, how long a person can phonate, right? They measure it in the clinic. It's a measure of air costs. In other words, are you not able to phonate for a long period of time? And then we try to find out why. All right, the average for an adult in terms of phonation time is about 16 seconds. All right, so if you take a breath, nice easy breath, and then phonate for, it's usually about 16 seconds on average. Children, it's much younger or much shorter. All right, they can do about 11 seconds, and then adults get up to about 16 or 17 seconds. Now, there's a factor called vocal jitter, also called perturbation. Vocal jitter is when your vocal cords are vibrating, but there's a type of irregularity in the vibration. And it doesn't take much. It results in sort of a rough, sort of shaky voice, okay, where it's like tremulous. It's uneven pattern of phonating. And in order to get the perception of vocal jitter, there just has to be a 1% change in the vibratory cycle, all right? So it doesn't take much to cause vocal jitter and get that perception. Some people, it's quite bad. I think on the PowerPoint, I have some examples for you. But vocal jitter is very, very sensitive to pathologies, your health status, even how nervous you are in getting up and talking in front of a group. Then breathiness is another factor that a pathologist will look at, how breathy someone's voice is. And some people's voices are just more breathy habitually than other people's. Doesn't mean it's pathological, but all right. Going on, acoustics is the measurement of sound levels and quality in a certain environment. All right. So some rooms, as I mentioned before, have really good acoustics. Some rooms, not so much. All right. If you want to have really good acoustics, you have a nicely shaped sort of a square room, or sometimes it's finely tuned in terms of the shape. But you want to have hard floors, hard walls, hard ceilings, and not a lot of obstructions. If you want to deaden the acoustics in a room, you want to hang tapestries and stuff from the walls or from the ceilings. When I worked at a private school, the rooms were all designed to have carpeting on the floor and then a different sort of more decorative carpeting halfway up the walls. And what the purpose of that was to deaden the sound in the room. It's quite effective. So that changed the acoustics. If you want to use a couple apps, there's one Decibel X and another one dBx, are apps for an iPhone anyway. You might want to look at those and play around with them a little bit. They help you sort of change the acoustics of a voice. You record into the phone, and then you can do some manipulations and make yourself sound like a little kid or make yourself sound like an old man. So you might want to play with that a little bit. On page 7 of your notes, there's a loudness chart. So it shows like a whisper or quiet room or light rainfall is very, very low in terms of decibels, in terms of noise. All right, the other end, things like car stereos, jackhammers, firearms, air raid sirens, heavy metal concert, they can be nearing the point of being dangerous for your hearing. Okay, I know when I went to college and would go to a concert, certainly on the ride home from the concert, my ears were ringing, wouldn't be able to hear very well. Sometimes it would last through the night. Sometimes I'd wake up in the morning and still have it, or sometimes it would be gone. But if someone works in like landscaping or works a jackhammer out on construction and they don't wear proper ear protection, it can affect their hearing long term. We're going to get into that next course and talk about the anatomy and physiology of hearing. But there is one example of a hearing habit that a lot of people don't pay attention to, and eventually it's going to harm them, and that is sitting in a closed car with your stereo blasting. I think we've all sometimes, pulled up to a stop sign or a stoplight, and then you notice that 2 or 3 cars ahead of you, somebody's got a really loud stereo going, and you can almost hear the vibrations coming from the car in front of you. That's very dangerous to our hearing. So that's something that especially young people have to be very careful of. So you need to know examples of dangerous sounds. Okay, looking at that chart, I would pay more attention to the ones on the right. And also know examples of various speech sounds that are either low frequency or high frequency, and which have voicing on them and which have not have no voicing. So let's start with voiced or voiceless first. Voiced sounds are sounds that are produced when your vocal cords are vibrating. So sounds like B and D and Z, M, N, and the vowels all require vocal cord vibration. Some of the voiceless sounds would be P, T, S. Okay, so if I say P, in terms of my articulation, it's the same as B. All right, what I'm doing in my mouth is exactly the same. P has no voicing down here. B has voicing down here. Same sound, they're called cognates. Same sounds, only one is voiced and the other one is different. So know some of the examples of those. In terms of high frequencies and low frequency sounds, high frequency sounds would be F. The unvoiced TH is in thing or thumb. The S sound is high frequency. And if you want to look at low frequency sounds, it would be M, Z, N. The voiced TH is in they. And of course, your vowels would be lower frequency. So know some of the examples of those. The connected speech, the co-articulation type of topic there. When we say a word like Mississippi, there's a lot going on in our vocal tract and in our articulators in our mouth, just to say that one little word, right? Co-articulation, what that means is the sound that I produce is colored by the sounds ahead of it and the sounds afterwards. So if I say the word bad, the A sound, the ah, sounds a certain way. But if I add an N to that word, so instead of saying bad, I say band, the N colors the A. The production of the A sound is actually changed by a sound that comes after it, band, okay? There are suprasegmental aspects of communication. These are things that are not voiced or articulated up here, but they are like very close to, you think of the things that we use in language in controlling our speech. So they would be things like pitch and intensity. They're very important to our use of language. I give an example of the same sentence, but 4 different variations of pronouncing it. So some of the linguistic aspects of pitch and intensity, right? Pitch and loudness would be the pitch, all right? Is it low or high on a musical scale? The intonation, whether we can talk about going up in our voice or going down in our voice, pitch-wise, all right? Like when you ask a question. The loudness, sometimes we use loudness to emphasize something. Sometimes we use stress in a specific word or a syllable, right, to emphasize the utterance. So that's what stress is, okay? We increase the intensity and the fundamental frequency. Duration, sometimes we want to make a point, and so we have to stretch things out. That's duration. And then rhythm is sort of the pace of it. You know, is it fast? Is it slow? Is it sort of syncopated, varied? All right. So the next section of our notes in our lecture talk about pathologies affecting phonation. There's a lot of things that can go into the different pathologies, things that can go wrong, right? Some definitions I want you to focus on, the bottom of page 9 in your notes. Edema is swelling. So you can have edema of your vocal cords. You can have edema of a structure in your mouth. You can have edema in your hand or finger. It's a swelling. Dysphonia means that there's a reduction in vocal function. In other words, your phonation is reduced in some way, right? Not as strong. That's dysphonia. Aphonia means you're completely losing your voice. You have no vocal cord vibration at all. That's aphonia. Diplophonia is where you are vibrating your vocal cords in such a way that you hear two pitched sounds. Right? I can't duplicate it for you, but some people talk and there's two notes coming out of their mouth at the same time. We talk about frequency in hertz. We talk about intensity and decibels. Pitch and loudness you know about, right? If we want to, or if you want to have a physician look into your throat and look at the function of your vocal cords, we use something called fiber endoscopy, right? Looking down your throat to see how your vocal cords function. They also use it to measure and assess swallowing. But there are two major classifications of organic, meaning structural voice problems. One is structural, okay? The anatomy is off. And the second would be neurological, where there are problems in the nervous system that affect how your vocal cords work. So one of the first ways to look at problem with your voice would be laryngeal trauma, all right? Most often this is the result of a motor vehicle accident. That's followed by sports. Usually we talk about blunt force, like something is hit against your throat and damage your vocal apparatus, your larynx, and also may damage how the vocal cords operate. So a lot of times, 85% of the time, it's because of a hard, blunt force against your throat. Sometimes it has to do with a penetrating wound, in other words, a puncture. Car accidents are a major example of this. Some of the signs and symptoms are dysphonia, meaning your vocal cords don't produce sounds exactly right. It could also result in dysphagia, which is swallowing disorder, pain during swallowing, changes in your voice, coughing up blood, a lot of things. Pediatric traumatic laryngeal injuries. These are not quite as common because in little kids, their voice box is higher in their throat and it's sort of up underneath the chin a little bit. As we grow, as our backbone and our structures expand, then your larynx area sort of moves down to here. But little children, it's right up in there. So there's usually less injury in pediatrics. All right, oftentimes it can be bicycle accidents or something called a clothesline injury, which means the kid is running and it doesn't see like a wire or a clothesline or a dog's leash or something that is out there, and they run right into it and it just hits their throat. So that is a problem, clothesline injury. Can also result from physical abuse of a child, all right? Attempting to strangle the child. Sports-related trauma, there are many causes in contact sports, right? Different sports are listed. Again, children have fewer injuries in sports when they're very little because of the location of their larynx. Clothesline injuries, again, are important there. Males seem to have, statistically, have more sports injuries than females do. But they can result in hoarseness, shortness of breath, coughing up blood, a lot of things. Gastroesophageal reflux disease is otherwise known as GERD. You'll see that a lot. It's often commonly called acid reflux also. The acids and chemicals in your stomach that we use to what's the word I'm looking for? Digest your food. For some reason that sort of comes back up into your throat and it gets into the area of your larynx, causes irritation, ulceration, may even lead to cancer at some point. It's where you get heartburn, an acidy taste, bad breath, damage even to your teeth with GERD. And there's a number of pathologies that obviously if your vocal cords are all irritated, that's going to be a problem. Then there's a number of growths which are non-cancerous, although they can maybe someday lead to cancer. But look at some of these. Vocal nodules, we're not going to mention all the ones that are in your notes or in the PowerPoint, but I'm going to highlight some. Vocal nodules are a collection of little firm tissues, like little bumps, almost like blisters, that arise from vocal abuse, yelling, clearing your throat all the time. There's hard contact to the vocal cords. They're slamming together all the time. It results in a thickening of the folds. Nodules can be unilateral, can be only on one side, but nodules usually are on both sides at the same place on both sides of the vocal cords. And I think I have a video, short little video for you to watch on the PowerPoint. This results in hoarseness for your voice, breathiness, sometimes even a pain in the throat. Contact ulcers, also known as granulomas, they're little sacs arising from vocal abuse or GERD or sometimes even surgery. They also result from compressing the vocal cords too forcefully. They can be surgically removed, but you need voice therapy to keep from having them return. Vocal nodules can also be removed, done surgically. In the old days, they used to go in with this knife type of apparatus to cut them off, but today they just use lasers to sort of slice them off. Contact ulcers can be repaired surgically. Hyperkeratosis, we're not going to worry about too much, but you can read about it in your notes. Laryngeal webbing is where there's actually like a web in the vocal folds. This is often detected at birth. It's usually congenital, but it needs to be removed immediately because it can compromise the child's breathing. There can be other types of webs that are acquired, right? They actually form later, and one very common cause of this is intubation, where they stick a tube down your trachea to allow the passage of air down your throat to open up your breathing passage. And sometimes it irritates the vocal cords when they do that. So it can cause a little web, little scar tissue, which you don't want. Papillomas are little wart-like growths. They are the result of virus infection. They result in hoarseness, short breath. Usually if you have papillomas, they sort of tend to go away when a child reaches puberty. They can be treated by surgery as well if they are really problematic, but sometimes they just sort of go away on their own. Polyps are very common. There can be two types. One is like a little growth that's on a stalk. It's called pedunculated. And the other one is sessile, where the growth is attached right to the vocal cord itself. These are usually unilateral. There's usually only one of them. In the PowerPoint, you will see a picture of those. And it's related, polyps are usually related to vocal abuse. You've been yelling too much. They result in a hoarse voice, a breathy voice. They also result in that diplophonia, okay? Because one vocal fold, at least part of it is vibrating at one way, and another part might be vibrating at another level of frequency. You get two pitch tones going out. Laryngitis, I think a lot of people know about. It's just a bacteria-caused dysphonia where you sort of get a hoarse voice for a while. You get some medication or something. Vocal folds become inflamed. They get breathy, but eventually it'll go away. Also can be caused by a virus. Now, laryngeal cancer is carcinoma. Can be life-threatening. So if you have voice box cancer or laryngeal cancer, it can in fact be life-threatening. It's often caused by smoking. You can have laryngeal cancer in the glottal area, right between the vocal folds. You can have cancer in the supraglottal, above the folds, and also subglottal, down in the cricoid area, down into the trachea, right? The treatment for this oftentimes is something called a laryngectomy, where they actually remove your voice box surgically. Also can use radiation and chemotherapy, but a lot of times it's a laryngectomy. The signs of laryngeal cancer: coughing, obviously, persistent hoarseness, sometimes pain to the ear, swelling neck, inspiratory stridor, which means when you're taking air in, you're sort of very noisy when you're doing that. You're straining. And then difficulty breathing is also an issue of laryngeal cancer. Squamous cell carcinoma is the most common type of laryngeal cancer. It affects both the vocal cords and the oral cavity and begins like a thickening and then can really interfere with your speaking, your phonation. Now, if you have a laryngectomy, if you were to have your voice box removed, there are some problems that are the result of that. You think, okay, well, I can still breathe. I got a hole right here. It's called the stoma, and I can breathe through that. I'll be fine. But there are some problems. You can't build up enough subglottal pressure to cough, for example, to clear your throat, because to cough, you need vocal cords. And if the vocal cords are gone, then you can't cough. You have to make sure you keep pet hair and dust and things away from this hole, because that's a direct tube right down to your lungs. So if you're breathing in impurities and dog hair, for example, it's going to go right into your lungs. You can't take a shower. You can't go swimming unless you cover that hole up. You can't smell. Smell is determined by your nasal passages. Okay, receptors in your nasal passages. And if the air isn't going to your nose, you cannot smell. Also can't blow your nose. All right. In the PowerPoint, it gives you two examples of ways that people can speak. One is called esophageal speech, where they actually, in their stoma, they breathe in air. Okay. I'm sorry. So esophageal speech, they don't use the stoma. Esophageal speech, they breathe in, they take in air like gulping, like swallowing air. It gets down into their stomach, and they burp it out. It sounds gross. There are some people who don't do it very well. There are some people who can't do it at all. But there are some people who sound almost natural, and they know how to lengthen the sounds out and whatever, so that their speech is very understandable. It just sounds like burped speech. So it sounds almost like, hello, how are you? That type of thing. And then other people use something called an electrolarynx. Electrolarynx is just a mechanical electric device. You put it up here, sounds like this when they talk, okay? It's usually one tone, sounds very mechanical, like a robot speech. Intubation, breathing tube down your throat, that can damage your phonation as well. So again, tracheotomy is the whole, production of the whole, and intubation causes damage to the cartilages. Degenerative diseases, Parkinson's disease, it's a nervous system degeneration. Amyotrophic lateral sclerosis, ALS, is progressive degeneration of the motor neurons. Multiple sclerosis is a progressive demyelination of the protective covering on the axons, all right? Myelin sheaths, if you remember from earlier in our course, myelin sheaths allow you to produce a better signal along the length of the axon. It protects the signal. But in multiple sclerosis, those myelin sheaths begin to deteriorate, and therefore you end up with confused signals or faulty signals, all right? And it ends up resulting in jerky, random muscle movements for ALS. It also has effects on your voice. Dysphonia, which is less production of phonation, breathiness, a harsh voice. Cerebral vascular accident, CVA, otherwise known as a stroke. It can happen in at least two ways. One is where there's actually a ruptured blood vessel. So in other words, your blood is leaking up in your brain, an aneurysm. Or ischemic, which is where the blood flow has been reduced or maybe even stopped. This can cause seizures, coma, dizziness, a lot of things. Can cause headaches, vomiting, and has very definite effects on your speech. Vocal cord paralysis, is recurrent laryngeal nerve of the vagus nerve, because the 10th vagus nerve innervates your vocal cords. This often happens, or frequently is seen sometimes when somebody has thyroid surgery. They have maybe partial vocal fold paralysis. Okay, what is the most common type of speech disorder when we look at a total population? If you look at all the speech disorders in the total population, the most common type of speech disorder would be voice problems. Okay, because kids have them, adults have them, the elderly especially have them. So voice problems are the most common speech disorder. And just to review, the two behaviors done by young people that I wanted to highlight in our lecture. One was the habitual use of that glottal fry, right, going down to the bottom of your pitch range when you're talking, right? And secondly, turning up the sound volume in a closed automobile. You do not want to be in a closed automobile and have the sound blasting. Okay? So that's the end of this chapter notes. If you have any questions, please email me. But this material will be on your next exam. Thank you.